everyone, welcome back to Facebook Live Fridays. I'm Brittany. I am here on the sidelines at Sickles High School. Tonight we have our sports medicine specialist, Dr. Adam Morse. How are you doing tonight?
Excellent. Glad to be here. Excited for the game tonight.
Good. Well, tonight we are going to be talking about hip injuries and treatment options. So if you have any questions about those topics, please comment below and we will be able to answer them throughout our video tonight. And also like and comment and share for your family and friends if you haven't already. So let's get right into it. So can you tell us what are some common hip injuries that occur in student athletes?
Some of the most common ones are going to vary from sport to sport. There's something called a hip pointer, which is the top of your hip bone that actually impacts on the ground. Other ones can be hip flexor strains where the tendons across the front of the hip occurs in kickers and punters most commonly, but also with explosive athletics and running and sprinting and changing speeds. Another one that's real common is hamstring injuries across the back, and in cutting you can get an abductor or an inside of the groin muscle tear. Those are the most common muscle and bone related injuries in football. There's a tendon that goes down the outside of the hip as well, which is commonly injured, called the iliotibial band. And on a rare occasion, you can get injuries to the hip joint, which can be more serious, or you can actually pull a chip of bone off with the tendon on either the hamstring or the hip flexor in the front of the hip.
Wow, that sounds really serious. So to prevent those types of things, what can student athletes do to prevent these things from happening?
So in football, one of the most common things that athletes have a tendency not to want to do is wear their lateral hip pads. That prevents a direct impact from a helmet, a shoulder pad, or the ground from giving you a hip pointer and having a bruise on the bone, which can take weeks and weeks to recover and get you out of the game. We want to keep you in the game, so that's one of the closest and best ways to do that. Stretching and warming up the muscles really good before games, before series of downs is also going to be very beneficial. So if you're on the sidelines and you're recovering and the ball switches hands, get up, jog out on the field, warm up, do a little quick 30-second stretch each time you go out to make sure that you don't get injured. And make sure you do warm up, not just jogging, but jogging to running to sprinting, back to running to jogging, so that you get a full array of exercise and warm up the hamstrings and the quads really good before you go out.
Perfect. Okay, great. And so if a student athlete, if they feel like they have a severe hip injury, how do they know if it's severe enough to talk to an athletic trainer or an orthopedic sports medicine specialist?
If you're having difficulty running full speed, you should probably get in immediately, talk to the athletic trainer either on the field or as soon as possible. If you are able to run, but you notice that you're getting soreness when you do run and it lasts more than about 3 or 4 days after activity, and you've been trying stretching, anti-inflammatories like Advil, ibuprofen, and icing, and it doesn't seem to be improving, I would go in and see the athletic trainer. And if it's to the point where it's severe enough that you're on crutches or that you're having difficulty standing, walking, just simple twisting and turning everyday activities, then I would get in to see somebody pretty quickly.
Okay, great. So when that happens and when it comes down to that it being that severe, what are some conservative and surgical treatment options they have available to them?
So frequently, most of these are going to be treated conservatively. We don't typically do a lot of surgery on these. Most of them, including the avulsion fractures, the tendons tend to heal on their own with rest. Sometimes it'll be crutches, usually a short period of rest for the bone or the tendon to start to heal up, and then a few weeks in physical therapy will get most people back on the field. On a rare occasion, if there's a large chunk of bone that's been moved off, or if they do some damage to the hip joint, there are surgeries that can repair that and fix those tendons and fix the joint and get you back on the field and play.
Awesome, great. And then if they do need surgery, will they be able to come back to the same level of performance after their surgery?
In most cases, yeah, most athletes can get back to competing at the same level of activity after a hip injury. On a rare occasion, it will be diminished, but for the most part, with proper treatment and early aggressive treatment, we can get you back on the field of play, back where you were.
Perfect, full recovery. That's awesome. Is there anything else you want to add?
Go Griffins! Let's kill them tonight. Happy homecoming.
Thank you so much for joining, everyone. Please be sure to comment if you have any questions. We will be able to answer them for you.
We actually have a question.
Perfect.
So before, when you were asking about or talking about taking ibuprofen before choosing a specialist, it says how long should you continue the ibuprofen or Advil before you realize that it's not going away? Like how many weeks?
Usually 2 weeks is about my limit on that. If you don't notice significant improvement within 2 weeks, then I would probably consult a physician. If you say, hey, I've been taking it and it's getting gradually better and better and better every day, it's not unreasonable to give it 2 weeks. If you notice, hey, I've been taking it every day for a week and I don't see any improvement, you might want to pop in a little early.
Awesome. Thank you guys so much for the questions. Keep them coming. We'll be able to answer them. And again, like and share with your family and your friends if you haven't already. Thank you so much for watching and have a good night. Tune in next week.